start with, what is diabetes? Diabetes, ultimately, we all know that, it raises your sugar levels, and, you are restricted to have few things, you have to probably go through the insulin shots, and, all things, half a knowledge, or maybe you call it as the way of living, whatever. So it is like, I am going to cover a lot of things on diabetes, about the diabetes management, about the foods, which can help you function better, and other stuff as well. So what is diabetes? Diabetes is a metabolic disorder. Okay, it's basically, it's a core, and it is something where, all other problems, all other ill healths are connected to this particular thing. Before I actually dive into the details of what exactly is diabetes, diabetes is not actually a disease. It's more like an endocrinological disorder, what we can call it as. So eventually, the bottom line would be that, you have to manage, you have to ensure that you're managing your diabetes to make your life better, and to ensure that, your physical and mental well-being is always at rest. Diabetes, because it's a metabolic disorder, there is a small problem where the body uses energy for its growth and development. So once you take any meal, okay, what is the next process which is expected? That your body enzymes, your insulin, which is a hormone, breaks down your food into the smaller absorbable particles of glucose for energy. So obviously the process itself is quite complex, but it is made more accessible to the cells. So now imagine if your insulin is not functioning properly, or you have some issues with insulin, then obviously your glucose metabolism is going to go for a toss. So to put it in simple words, your smaller units of sugar, which are responsible to give you energy for basic maintenance of body functions, is hampered. How would you correct it? Well, for cells, the cells only recognize one primary source of energy, which is glucose. And because you need good amount of food, a balanced meal, to ensure that your glucose is getting utilized by your cell, and it is getting more permeable to your cells. So insulin is released in your bloodstream to accommodate sugar that is present in the blood. Okay, when I'm eating a meal, okay, the body hormones will respond to this, and insulin will get released in my bloodstream. Now, in the normal scenario, there would be optimum discharge of insulin to make sure that my sugar levels are getting balanced. In case of deficiencies, obviously there would be heights, there would be spikes in the sugar levels, because my insulin is compromised, or maybe it's not that active the way it should be. So in diabetes, either there is a deficiency of insulin completely, and of course there is an insulin resistance, which is compatible to other factors as well, which we'll see in our next slides. Okay, so what are the type of diabetes? We know that around 477 million people on this globe, are having this issue. India being the diabetic capital of the world now. So it's very important to understand that what all kind of diabetes do we actually see. The most common form of diabetes, which has around 77% of the total population of the globe, has non-insulin dependent diabetes, which is type 2 diabetes. Obviously, the second lead would be, you have insulin dependent diabetes, which is called as type 1 diabetes. You have gestational diabetes. Gestational diabetes majorly seen in pregnant females, when they are actually having a process of childbearing, and that's when they show insulin resistance, and which are potential candidates of developing type 2 diabetes mellitus. Rest 1% of the total population of diabetes are majorly, due to some immunological issues. So of course, they are very rarest form, but the most common, which is ruling the entire globe, is type 2 diabetes mellitus. When your sugar levels are not, they are not up to the mark, they are not managed well, long-standing complications of diabetes. All these complications, what you can see right in front of your eyes, are like, long-standing complications of diabetes. In my previous slide, I did mention about that diabetes is a hub of developing other potential health issues. In fact, even today in our clinical practice, around 85 to 90% of people, walking into my clinic with the issue of diabetes have some or the other complications, related to it. So diabetes can never stay alone in your body, and that is why it becomes extremely important and critical to manage diabetes. It can never stay in your body, doing nothing. It needs a companion. So it will slowly and gradually start weakening your heart, your liver, your kidneys, your eyes, your bones, your nerves, etc. So obviously, complications of diabetes are categorized into two parts. One is micro, and second is microvascular and macrovascular. Micro involves, my retinopathy, what we call it as, So people with poor sugar control have glaucoma, which is clouding of retina. The vision is not clear. They have early cataracts. So again, it's very important to understand that diabetes, the crystals of sugar, do get deposited at your retina, and because of that, you face a lot of issues related to your eyes, which is called retinopathy. You have something which is called as neuropathy, because your body, from head to toe, is like, they have millions of nerves, coming, taking the blood, and they ensure that your body functions are not impaired by any chance. They get affected. Also, your kidneys do get affected, which is called nephropathy, which is another form of micro vascular complication of diabetes. Coming to macro vascular, obviously my cerebral, that is, chances of me getting strokes, chances of me getting or developing coronary artery diseases, heart attacks, myocardial infarctions, heart attack, cardiac arrest, are on a higher side. Just to make sure that these all complications of diabetes are often associated with progression of uncontrolled sugars over the years. So for example, if someone is having diabetes, or it is a newly detected diabetes type 2, and these all complications are majorly associated with type 2 diabetes. Type 1 diabetes is complete absence of insulin. So insulin management is done through insulin injections, insulin pumps, whereas type 2, so these all complications are associated with type 2, which is the most common ruling form of diabetes worldwide. So these all things are like associated with poor functions of nerves, poor functions of liver, poor functions of kidneys. My heart is getting affected, my brain, because everything is connected to these all things. When I am not able to manage my sugar levels, up to the mark, obviously this is going to lead me somewhere in future with the complications, as mentioned, on the slide. So it's very important to understand that everything boils down to one thing, which is good level of sugar. Your sugar levels have to be managed in a way where you are leading a very healthy and a normal life, without any complications. Obviously, one of the complication and a major complication is like, poor wound healing, and it leads to diabetic foot, basically. So because there's a loss of sensation, especially in diabetic individuals, so they don't feel anything in the low proximity, and that is why you would have heard people saying that you need to take care of your foot if you're diabetic. So obviously this happens only when your sugar levels are just creating havoc, and they are way out of the range, for you to being able to manage it well. So diabetic foot is the most common form of complication. In fact, one of the protocols of us, giving a diabetes management program to anyone also involves a good foot care routine, for the simple reason that such people having history of diabetes from past 25 years or maybe 30 years would sometime somewhere in their life would have some issues related to their nerve and neuropathy, which is going to come. But we have to ensure that we are just delaying the progression of these complications. And individuals who are able to manage their sugar levels well would definitely be very healthy, and they would definitely not land up in some serious complications of diabetes, as I mentioned earlier.